So at Moorfields Eye Hospital, we pride ourselves on constantly trying to deliver excellent care. Most importantly, we focus on being caring as an organisation, supporting patients, supporting the needs that they have, that their family have and their carers have. Across 30 sites and with a big, busy ophthalmology service, that's only possible with the support of fantastic volunteers. We're incredibly lucky with the Friends of Moorfields that we have an army of people. I'd like to say 24/7, it feels like 24/7, that are supporting our patients, supporting our staff in delivering that level of care. Without them, I think it would be impossible to be the fantastic hospital that we are, and we remain incredibly grateful.
We have a team of volunteers who support the Health Hub at the City Road, and most importantly, we provide emotional support for patients in the satellite site of Moorfields Eye Hospital, and volunteers work alongside the eye clinic liaison officers to signpost patients to the services and organizations that can help them with information and to manage their condition easier day by day.
It's such a lovely feeling to be able to help somebody who needs your help, and to be appreciated, and not to just be part of helping people to get better and to make their lives happy.
From our staff's point of view, our Friends of Moorfields volunteers support us in so many different ways. They are with us at the very beginning of our patient journey. They're clearly visible, they're wearing their brand new uniform, so they're instantly recognisable for our patients and also for our staff. So they meet the patients at the front door and they support them at the kiosk, which is basically the first place where that patient might stop on their journey. And the Friends of Moorfields are helping us in so many different ways. They run a shop for us, and the shop has definitely evolved since it's first started. We've now got products from the RNIB, such as talking watches, which can assist our patients who are visually impaired. But they also make sure that there's a healthy food options available for not just the patients but also for the staff. They also support our patients through the clinics with their refreshment trolley, which goes to all levels of the hospital and helps us to make sure that our patients receive something during their long waits sometimes. They've also supported us with our Patient Pages project, so the patients who might want to leave the clinic and go for a cup of tea or use the bathroom facilities can do so knowing that they're going to be alerted to the time of their appointment by using the Patient Coaster Pager. They've done so many and they're fantastic. We consider them to be part of our team. They also made sure that there's magazines in the clinics for our patients, because we do recognise from our friends and family feedback that a lot of our patients do want to have some diversion therapy in the clinics, and having a magazine to look at is really good. They've also got a new project for hand holding for our patients who are going to theatre. I know that if I was a patient, and your eyes are so precious, to have someone in the theatre with you just holding your hand would really help to allay your fears. So that's just one of the many projects that the Friends of Moorfields have helped us with. And I feel very lucky to work alongside them and have them as part of the team.
We're actually rather unique in that Moorfields entrusts its entire volunteer programme to its Friends charity. The majority of NHS trusts actually manage the volunteers themselves, but Moorfields has entrusted us to do this, and we employ staff that are actually work for the Friends of Moorfields as opposed to the trust, but we work very, very closely with the staff of the trust. We meet regularly with them to ensure that the roles are what's needed, and we have a very close relationship with service managers, the divisional directors and with the exec team, and we feel very much part of the Moorfields group. So the Director of Nursing is the exec lead for volunteering, and she's also a Friends of Moorfields trustee. So I meet with her monthly, where I give reports on what the volunteers are up to. We also work very closely with the matrons, both in the outpatients and the Richard Desmond Children's Centre. And we also work very closely with the clinic managers and the service improvement teams. So I really feel that both the Friends staff team, the trust staff and the volunteers themselves all work together and all have got a real passionate commitment to making sure that the patient journey is as good as it can possibly be.